Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be showing you an established patient visit who has been injured in an automobile accident from a front-end impact. So, let's have you stand up right here, Dorothy, and we're going to evaluate your posture first. Very good. Now, let's have you close your eyes, flex your head forward all the way. Now, see, there's a lot of pulling in there, right there in the neck and upper back. Now, backwards all the way. And it kinks right there. Now normal. Okay, just hold that position. What I'm doing right now is I'm documenting her posture three-dimensionally on X, Y, Z axes. As you can see, her left shoulder's way high. She's rotated from sleeping. Her head's also in a forward posture. And she's probably been sleeping on her side too. And if you notice, her pelvis has translated on the x-axis way to the left of center. And it's also rotated along with the rest of her body. But there's a counter rotation. She's rotated to the left in her head, but she's rotated to the right down here. So in her spine, it's like wringing out a wet rag. Okay, you can open your eyes up for me, Dorothy, and let's have you come over here and lie on your tummy for me next. Let's take your glasses. Here you go. Put those right here. Yeah, I'm going to have you put your face right down in there. And as you can see, she is boss. All of our patients are boss. Now, as we evaluate her leg length, her right leg is short by 1/2 inch. Now, it gets even when I bring it up, but watch her pelvis rock right there. That tells me that she's got pelvic subluxations right here in the right sacroiliac joint, as well as L5, 4, 3, 2, and 1. You can actually see the right side of her paraspinal musculature is elevated over the left side, and her right hip's also sticking up more. So the very first thing that I'm going to do is adjust the right sacroiliac joint in an X, Y, and Z axes. There we go. Now hers is internally rotated, but it's also posteriorly rotated. So that's why I'm adjusting that. Now here's the middle triangular shaped bone called the sacrum. And you notice I'm getting a straight superior to inferior drive on this one, not only in the y-axis, but the z-axis, as well as the x-axis. Now you notice I'm adjusting her left sacroiliac differently. Very good. And then we come right up here and get on L5. Perfect. L4, right there. L3. Now you'll notice how the line of drive changes as I move up the spine. And she's still got a little bit right here on this right sacroiliac. There we go. Now I'm going to do a nice general manipulation in her thoracic spine. There we go. That's a girl. And you just catch him exactly in the right between the breasts. Good. Now she's got a little bit more right there. Now as we come up into her upper thoracics, we're going to be adjusting. There we go. T1, 2, and 3. Perfect. Good job. Now, that leveled out her pelvis as well as her right paraspinal musculature. Her legs are exactly even now. Good. Excellent. Now what we're going to do is we are going to take this genie rub and we are going to stimulate her tissues, meaning muscles and ligaments, as well as the blood, circulatory system, and most importantly, the nervous system. Besides that, feels pretty good, doesn't it, Dorothy? Everybody likes this part. And you notice that I'm actually digging in really deep into the areas that have the trigger points. And And then way down into the hamstrings as well. This right one's really tight, but that's the one that was misaligned the most on her too, is her right sacroiliac joint. Now, notice I'm putting a lot of pressure on this, so this is not just your rubby feel-good activity. Now, as a result of her cervical spine being subluxated, she has numbness and tingling that has radiated out into both of her arms, hands, and wrist, all the way into her fingers. So we're going to be adjusting her cervical spine next, putting those vertebrae back in place. We're going to adjust her shoulders, elbows, and wrists, take off that pinching on all the nerves. There we go. Very good. Now, what I'm going to do, I'm going to have you turn on your back for me now, Dorothy. Very good. Okay, just right there. Yep. Drop this one right in my hand here. Perfect. Good job. Let it go right in my hand. Yes, ma'am. I'm sure you heard that one all the way on the cameras over there. That was perfect. Now, I am going to adjust her chest as well as her rib cage anteriorly. If you'll put your hands out just like this for me. There you go. We're going to adjust both of her AC joints, her clavicle, and I'm not choking her here, there, and her anterior ribs bilaterally. Excellent. Good. Now let's have you sit up sideways and face there. Very good. Now, she has numbness and tingling coming all the way down here, and we checked the strength. Let's just have you hold that real hard. See, she's very weak right there right now. I want to show you what it does when we free up the nervous system, not just from the neck, but all the way down into the hands, the wrist, and the fingers. Just let that relax. There you go. Excellent. Perfect. She's sounding like a bowl of Rice Krispies. I'm just pouring on the milk. Now, let's hold those together again. Did that feel stronger to you?
Yes.
Yes. Now we're going to come do the same thing on this right one, because we don't want to let her leave here with any headaches or numbness or tingling or any other symptoms for that matter. And she's done quite well with her entire treatment plan. There we go. Very nice. Now let's hold those together again. Oh, is that stronger that time? That's great. Well, this is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.